Hello, Assalamualaikum and good morning. My name is Nurhij Najha Binti Jama and I'm going to present about cardiovascular system in occupational health. What is cardiovascular system? The cardiovascular system consists of the heart, blood vessels and blood. The primary function is to transport the nutrients and oxygenated-rich blood to all parts of the body and to carry deoxygenated blood through the lungs. Firstly, we have to know the basic anatomy of the heart. Basic anatomy of the heart consists of vena cava, aorta, pulmonary artery, left coronary artery, coronary veins, right coronary artery. Left coronary artery divides into two branches, the circumflex artery and the left anterior descending artery. Circumflex artery supplies blood to the left atriums and the side and the back of the left ventricle. Meanwhile, left anterior descending artery supplies blood to the front and the bottom of the left ventricles and the front of the septum. So, we will move to the component of the cardiovascular system. The cardiovascular system is the responsible system for delivering blood to the different body parts. It consists of the heart, a muscular pump that forces blood around the body, and a closed system that includes arteries, veins, and capillaries. The heart has 4 chambers, 2 atria and 2 ventricles. There is a wall, septum, between the 2 atria and another wall between the 2 ventricles. Arteries carry blood away from the heart and the veins carry blood to the heart. Meanwhile, the flow of the blood through the vessels and the chamber of the heart is controlled by valve. There are 2 blood circulatory systems in the body. First, systematic circulatory system. This is the main blood circulatory system that transports blood to the organ, tissues and cells throughout the body. Meanwhile, pulmonary circulatory system move blood between the heart and lungs. It is where oxygen enters the blood and carbon dioxide leaves the body. What is occupational cardiovascular disease? Occupational cardiovascular disease is the heart or blood vessels that are caused by working conditions, making them a form of occupational illness. So, let's see what is the most common occupational cardiovascular disease. Most common cardiovascular diseases include angina, hypertension, dysrhythmias, cardiomyopathy, and angiogenesis. So, let me explain further about angina. Angina is a type of chest pain caused by reduced blood flow to the heart. Angina is a symptom of coronary artery disease. Angina pain is often described as squeezing, pressure, heaviness, tightness, or pain in the chest. Cardiovascular complication of carbon monoxide poisoning has been well reported and include myocardial stunning, left ventricular system dysfunction, pulmonary edema, and arrhythmias. When the carbon monoxide and the oxygens are inhaled to the respiratory system, the carbon monoxide enter the bloodstream and then combine with the hemoglobin. The body replaces the oxygens in red blood cell with carbon monoxide. This can lead to the serious tissue damage and can be life-threatening. The sign and symptom of carbon monoxide poisoning include dizziness, weakness, headache, loss of consciousness, blurred vision, confusion, and difficulty of breathing. The second occupational cardiovascular disease is atherosclerosis. Atherosclerosis starts with a fatty deposit. The process of arteries thickening and narrowing is brought about through linked process called atherosclerosis and thrombogenesis. The fibrous tissues then grows around the fatty deposits, creating an atherosclerotic plaque which protrudes into the lumens of the artery and narrowing it. Carbon disulfide is a toxic to the heart and arteries. Chronic exposure can result in accelerated atherosclerosis and coronary artery disease in human and animals. The third occupational cardiovascular disease is hypertension. Hypertension is the force that your blood exerts on the wall of blood vessels, as blood is circulated around the body. Lead poisoning occurs when the lead builds up in the body, often over months or years. Even small amount of lead can cause serious health problems. So next, I'm going to explain about dysrhythmias. Dysrhythmias is an abnormal or irregular heartbeat. It is caused by changes in heart tissue and activities or in the electrical signal that control the heartbeat. Working in solvent industry is a risk of developing arrhythmia. Exposure to chemical, especially solvents agents, mostly affects the cardiovascular system. Methylene chloride is another solvent used painting and manufacturing and used as a direct solvent. It can be inhaled or absorbed through the skin. So the last occupational cardiovascular disease is cardiomyopathy. Cardiomyopathy is a disease of the heart muscle that makes it harder for the heart to pump blood to all the rest of the body. It can lead to the heart failure. Acute arsenic poisoning may cause both diffuse capillary leakage and cardiomyopathy resulting in shock. How can occupational cardiovascular disease can be prevented? It can be prevented by reduce and manage stress. Be aware of potential workplace hazard. You must follow workplace safety guidelines and manage physical demands. Eat healthy diet, exercise regularly, and do not smoke. Smoking can increase the risk of cardiovascular disease, and most importantly, you have to educate your workers. So that's all for me. Thank you.